We're going to learn more about a program. It's called the Mobile Response and Stabilization Services. It's with Coleman Health Services, and we're going to learn about the program and what needs they might have. To my immediate left, she is the Chief Officer of Coleman Health Services, Margaret Lawrence, and then Katie Murphy. She's the MRSS team leader for Allen, Auglaize, Hardin, and Putnam counties with Coleman. And thank you both for coming today.
Sure, yes.
Thank you. Okay, so Margaret, let's first talk about this program because there was a need, and you're trying to fill the need with this. What do you target? What's your mission with this program?
So this program actually started back in 2017, and the need was a youth in the home that was struggling with behavior issues or maybe family conflict, having a team to go out and help the family. And our goal was that the family define the crisis. So if the crisis was Johnny wouldn't go to school today, we need someone to help us as a family to help with Johnny. That's what the goal was. Family defined crisis.
All right. So Katie, are you feeling that, like, you're reaching out to some of these kids and helping, that the program is working?
Yes, yes. I think that we see a lot of families, and a lot of families report that they've noticed that they've learned coping skills, that they've had de-escalation in the home, and we also get them connected to other agencies for long-term care, which really helps the families as well.
Yeah, I feel like maybe some of these situations, like, parenting doesn't come with that playbook to tell you what to do, right?
That's what the families say, yes.
Yeah, so you're kind of helping them, get a little bit of a playbook, a plan to help with the family?
Yes, so they send out a social worker or a counselor, a case manager, and we also have a certified recovery coach. We actually have two. So it depends on the needs of the family. Our goal is to link them to resources and also link them to other services that may be long-term. So this team, Mobile Response Stabilization, is short-term.
Okay.
So we spend a short-term amount of with the family, and then we link them to other services.
All right, very good. So if it is short-term, I mean, what are some of the other issues maybe that you can help with? I mean, you mentioned not going to school. Are these also like some mental health issues or suicide tendencies, anything like that? Or what do you guys reach out and help with? Yeah.
Sure. So we can help with a wide variety of issues. We see a lot of behavioral health concerns, mental health concerns, sometimes substance use concerns. And the goal with MRSS is to help reduce hospital ER visits, as well as law enforcement having to go to respond to domestic violence situations. We can kind of help get in that and help stabilize the family. So,
right, yeah. We are talking more about mental health and, the importance of it. So do you think that maybe more people will begin to reach out to you more when they hear more about this program?
Our hope is that more people reach out because we can help to link them not just to Coleman services, but to community services, whether it's, the young person needing to go to SAFI drop-in center or Family Resource Center or use Coleman services. But the goal is to help the families to know that there are a lot of good resources here in our community.
And that's kind of the key, that we do have good resources in our community, right? Thanks to Mental Health Recovery Services. I mean, all the other, agencies, right? We have help for them.
Absolutely, absolutely, and that's what we're here for.
Yeah, exactly. All right, so to help all these kids, though, you need staff, right? So you need people to think about a future and perhaps your field. Tell us more about, like, what kind of person, what kind of help you need.
So we need someone that's interested in working in the community, social worker, counselors, or even a case manager. A case manager doesn't require a degree. We give a lot of training at Coleman, but you just have to be community oriented, that you're not afraid to be out in someone's home working with a family.
And I assume it's a team effort, right?
Yes.
You guys have been talking about that, how you have a team.
It's a team approach, yep. Yes, we have currently, we have one clinical therapist, one case manager, and 2 certified peer supports. And we all work as a team to go out and help assist with the family.
All right, sounds like it's really great work. And is there an age, like, 25 and under or 21? I mean, age bracket for this program?
It is from birth to 21.
Okay,
so even if mom has a newborn and is struggling maybe with some postpartum or things like that, we can certainly go out and assist and help with that too.
Right, yeah. Sounds like we're really trying to help at home, which is much better, right?
Yes.
Keep them in an environment where they're comfortable for the most part, right?
Yes, yes. They will meet them in the park. They will meet them wherever the family decides they want to meet, because the family is in control of the situation, and we're just there to support and give them hope.
Wow, what a neat program. Thanks for explaining it to everyone. Hopefully people get the information on the screen and reach out. So thanks for coming today, both of you.
Thank you.
Thank
Thanks
you
for having us.
All right, don't go away. We'll take a look at the weather forecast next.